If you're getting older in Newfoundland, you may choose to spend your later years in a personal care home, a place where seniors can get the support they need as they age while still enjoying some independence. Personal care homes are privately owned, but the provincial regulator, Newfoundland and Labrador Health Services, or NLHS, is supposed to oversee them, holding them to strict standards of care and quality. But an Auditor General report has revealed that NLHS has failed in its oversight of personal care homes. Homes in the province are consistently relicensed when they shouldn't be, allowed to operate well below standards, employ unqualified individuals, and at times neglect and abuse residents, all while the province has some of the highest monthly costs for personal care homes in the country. This is part one of a two-part series looking at Newfoundland's healthcare system. This episode, what is going on inside personal care homes? Newfoundland has a wide variety of providers who own personal care homes across the province. Unlike long-term care, which is primarily publicly owned, personal care homes offer a less intensive level of care. Both are subsidized by the government. In fact, well over 80% of personal care home residents receive some government assistance to pay for their rent. But still, personal care homes must meet government standards on a wide variety of things, like what food to serve and how to serve it, how medications should be stored and administered, how to do resident assessments and how long they should take, etc. NLHS and the Department of Health and Community Services are responsible for monitoring and assessing the homes to ensure they're up to standards. But before we talk about how they failed to meet standards, let's talk about the standards. The Newfoundland government has not updated its standards for personal care homes since 2007, making them the most out of date of any of the Atlantic provinces. New standards were drafted in 2022 but have not been adopted. In 2015, the Auditor General released a report finding that the Newfoundland government had not regulated personal care homes in accordance with their own standards. Perhaps more alarming in our current context is that it found that the 2007 operating standards were outdated even back in 2015, and that 44% of the performance measures in the operating standards were too vague and so didn't serve as effective measures for determining whether personal care homes and their staff were complying with standards in the first place. To add to that, regulators were not consistently completing performance reviews that were required by the standards, and when they weren't consistently monitoring for the same performance metrics, meaning that some homes were being judged differently than others. There's a lot more in that 2015 report, but to sum it up generally, regulators did a bad job of properly reviewing homes, the standards were already outdated and insufficient in some ways, and there were a number of problems with homes not meeting regulatory standards but still getting licenses. Problems that were identified in the 2015 report and got worse by the 2025 report. So let's dive into that 2025 report, which found rampant issues in personal care homes. Let's start with one of the very few things the home seems to be doing properly. All of the homes that were visited had adequate staffing numbers, according to standards, but everything else surrounding staffing was less good. 66% of employees had at least one instance where they did not meet hiring requirements. Others had said they met hiring requirements, but had been approved based on their word, rather than seeing the required documents to prove what they were saying. And even then, Newfoundland doesn't require that employees at personal care homes have any kind of professional accreditation. 5% of employees had violated the certificate of conduct, including having assault charges, and yet continued to work in the homes afterwards. In general, the standard of training for employees was all over the place. Some homes gave only minimal training, others gave none at all. That lack of training extended to some critical areas, like medical storage and administration. 27% of employees administering medication had not completed a mandatory 3-month review of medication policies, in part leading to 51 incident reports related to medication. 92% of the homes studied in the report had medication-related incidents since March 1, 2024. A quick list of other things: 54% of meals didn't match the approved menu or meet Canada's food guide, 31% of homes didn't have residents' allergies clearly posted, 47% of residents waited over 100 days for their resident assessment, the assessment that personalizes their care, to be approved. I can go on, but while all of these things were going wrong in the homes, the NLHS continued to give licenses, even when there were multiple instances of non-compliance. The regulatory standards state that NLHS must monitor and report on each home quarterly. But in 2017, they stopped this practice because NLHS's reports lacked proper context. So rather than updating regulatory standards to improve the quality of reporting, the Department of Health and Community Services just occasionally asked NLHS to report quarterly at random. Even when NLHS did look into a home, there's evidence they came to false conclusions. In 40% of their reports, the Auditor General found that there was little to no evidence to support the conclusions NLHS came to. For the quarterly monitoring that NLHS did do, 86% of their reports found instances of non-compliance with operational standards. Yet even in the face of that, NLHS largely did nothing. They consistently did not address issues of non-compliance, issues that could have been addressed by issuing a conditional license or revoking the home's license entirely. Even in the cases where they did issue a conditional license, they didn't set up any kind of plan to fix the issues. Typically, conditional licenses are issued for periods of 3 months, after which the license is restored or revoked. Instead, NLHS would issue conditional licenses for unspecified amounts of time, allowing homes to operate as normal with no consequences, despite not meeting standards. In one case, a home received complaints of poor conditions, including rooms with feces on the wall, even after cleaning staff had been through. That home had been operating under a conditional license for 27 months. In other conditions, residents complained of abuse, including sexual assault. Some residents were not allowed to shower more than once a week. Others were financially abused by the owner of the home. The Department of Health and Community Services was no better. They did not even have a process in place to check if NLHS was following the requirements to license or monitor personal care homes, instead leaving it completely up to the discretion of NLHS. Another area where both departments seem to have had very little oversight is in evictions. Personal care homes evicted 254 residents over 3 years. 91 of those evictions occurred when residents were sent to the emergency room and were not permitted back in their home afterwards. The department and NLHS were aware of this, but did nothing about it. NLHS didn't even keep any records of resident evictions except for the numbered monthly eviction stats they were required to report to the department. All of these factors work together to contribute to perhaps the most tragic part of this report. The Department of Health and Community Services had absolutely no written policies, procedures, or processes to handle serious incidents, or any processes to oversee how serious incidents were dealt with by NLHS. And multiple very serious incidents occurred. In one instance, staff left a resident outside on their own. The resident went for a walk and did not return. They were found deceased later that day. In another case, a staff member gave a resident a number of medications that weren't theirs. The resident died of an overdose. These were the only 2 out of 8 serious incidents that had any follow-up. And in one case, that follow-up was an email over 2 months later. The other serious incidents that weren't followed up on included a resident falling down an embankment and a resident going missing due to dementia. These are a number of serious incidents and 2 entirely preventable deaths, with very little meaningful response from the personal care homes or the organizations responsible for overseeing them. Unfortunately, things are not likely to get better quickly for personal care homes. Canada's population is aging. Around 4,400 people lived in personal care homes during the time of the report, and that number is certain to increase. At the same time, several homes closed or had their licenses removed during that same time period. Almost all of the issues pointed out in the 2015 Auditor General report got worse over the next 10 years. Healthcare across Newfoundland is stressed and money is tight. The province already spends 28% of its health budget on long-term care, well above the national average. So how did things get so bad? Well, part of it is simply neglect and misplaced priorities on the part of the Newfoundland government. Recently, the province has introduced a department that specifically oversees healthcare for seniors, as the General Department of Health is often focused on acute care. But part of it is the nature of long-term care as a whole. Long-term care beds are scarce, and their waiting lists can be extremely long. Governments often focus on what is happening within their 4-year term, meaning that although we have known for a long time that our population was aging, and this would be the result, governments did not adequately prepare by building new long-term care facilities well in advance. This often leads to 2 results. The first is that seniors who really should be in a long-term care facility instead end up in a personal care home, or other type of retirement community that doesn't offer the level of care a long-term care home would provide. This means that neither staff or the home are equipped to necessarily meet each resident's needs. It often means that governments often turn to privatization. Although significant research shows that privatizing senior care does not deliver savings in the long run, it helps governments avoid breaking the budget at the beginning. It's much easier to hire a private company to build a new long-term care facility or retirement community and then subsidize it than it is to find the tax dollars to build the facility. But then, privatized homes have to pay their executives, profits are paid to owners, costs are paid in negotiating contracts. All of these things cost more money in the long run and result in worse care, as the company is motivated by profits and not by its residents. As there is already a shortage of beds, residents lack choice, and so companies have very little incentive to offer better care than whatever is the cheapest to deliver. It creates a cycle that's made worse by an aging population. Private care homes cost taxpayers more in the long run for the same care in comparison to public homes. That means there's less money available to expand care. More seniors needing more beds comes up against a government with less and less funding available for those beds, leading to a lower quality of care, fewer new facilities, and less money and time available to regulate and oversee the facilities that are already operating. Staffing differences between for-profit and non-profit care homes is a consistent finding. Publicly owned facilities consistently have higher nurse staffing levels than for-profit facilities. All of these factors together meant that care at personal care homes in Newfoundland has gotten worse over the last 10 years, not to mention COVID, which disproportionately affected long-term care and retirement communities. And while care suffered, the healthcare regulators who were supposed to hold the homes to account were overworked and underfunded themselves, allowing personal care homes to operate well below standards with virtually no consequences. There are a few glimmers of hope. In June, 4 personal care homes in Newfoundland became the first to receive national accreditation for their quality of care. To achieve that, they had to undergo a rigorous 2-year assessment to raise their operations to the national standard of care. Those 4 homes, at least, are holding themselves to a high standard, even if the province won't. But despite all of the legitimate reasons why personal care homes are underfunded and understandard, Newfoundland also threw away millions of healthcare dollars on agency nurses, as documented in another Auditor General report that alleges conflicts of interest, incompetence, and maybe even corruption and theft. That's in part 2, next week.